Texas Attorney General Ken Paxton is suing a Dallas Children's Hospital for performing what he calls illegal gender operations on children. And in New York City, a top hospital has ended its transgender youth treatments because the Trump administration threatened to gut the hospital's federal funding. Several clinics across America now have begun scaling back the harmful procedures on children, and this includes hospitals in Democrat strongholds like California, Massachusetts, Washington State. Detransitioner Chloe Cole on Fox.
I think that this is an exciting trend of many hospitals. I think over 40 clinics that have chosen to either temporarily stop or permanently shut down their clinics that are perpetuating this abuse against children in their communities. And hopefully this will be followed by many more.
Alexis McAdams has our report on this. Alexis.
Hi, Harris. Well, here in Deep Blue, New York, not everybody's excited about it, but those changes are already happening. It means no more puberty blockers, no more hormones or medical transition care for minors at one of New York's biggest hospitals. So NYU Langone Hospital blames the change, though, on the, quote, current regulatory environment, saying in part, we made the difficult decision to discontinue our transgender youth health program. We're committed, though, to helping patients in our care manage the change. It's not just NYU Langone. This is happening across the country. California's largest children's hospital out of Los Angeles did this, Yale New Haven Health, and Lurie's Children's Hospital in Chicago, just to name a few that are doing this. And so they're pausing, Harris, or ending gender-affirming care and those surgeries. Dr. Ira Savetsky, he trained at NYU. He was on Fox today talking about how doctors can't cave to pressure. You got to follow the science.
As physicians, we're supposed to follow evidence-based medicine, and so much of the data did not show that what we were doing was the right thing. The goal is to prevent suicide, to improve mental health in the youth, and the data did not show that.
So people wondering, why are these hospitals changing course now? Well, President Trump signed an executive order last year. He warned hospitals they could lose their federal funding for Medicare and Medicaid over this if they kept it up. But here in New York, Letitia James says hospitals have to follow the law, not President Trump. And Mayor Zoran Mamdani campaigned on giving, listen to this, $65 million in our taxpayer money, Harris, to providers for serving trans patients in the Big Apple, including minors. Neither has responded to our request for comment on Langone's decision to end their trans youth health programs. But the hospital has already taken the trans youth program page, Harris, off the website. It's gone, but they will offer mental health and supportive services. So we'll see what happens next.
Well, I would hope that they would be doing that in the first place anyway. But let's ask a doctor. Great reporting, Alexis. Right. Thank you. And Focus now, Dr. Nicole Saphier, board-certified physician and Fox News contributor. You and I have had this conversation many times, and I'm wondering, why don't we start with support in that venue of we're going to treat the whole child?
Well, that's right, Harris. And so for years, and we're still currently hearing from people who support gender transitioning in minors, that the medical interventions are evidence-based and they're life-saving. Well, the reality is, Harris, this is factually incorrect. The medical and legal professionals who continue to say this are lying to your face. Harris, you and I have been saying this for years on multiple platforms. When we have good evidence-based medicine, you have replicated studies that are well designed, that there is a proven benefit. We do not have that here when it comes to medical intervention in children. In fact, what we have is misrepresentation of observational data. And because of that, even the most liberal countries are pulling back from this. They have misrepresented the data. There were not fewer suicides. There were not fewer substance abuses. They've been lying to us.
Yeah, and how can you do the right thing if someone won't tell you what the truth is? Dr. Saphier, thank you very much for being with me.